Teenage surgery secret. On September 12, 2025, 14-year-old Paloma Nicole Arellano Escobedo underwent 3 major cosmetic procedures at a private clinic in Durango, Mexico. The surgeon was her mother's boyfriend, Victor Manuel Rosales Galindo, a 45-year-old plastic surgeon who performed breast augmentation, liposuction, and a Brazilian butt lift simultaneously. Her father, Carlos Said Arellano, knew nothing about the procedures. Paloma's mother accompanied her daughter to the clinic and constructed an elaborate deception. She told Carlos that Paloma had been hospitalized with COVID-19 complications. For 8 days following the surgery, Paloma's condition deteriorated, with blood pressure drops, circulation failure, and brain complications. Her father believed his daughter was fighting a virus. On September 20th, 8 days after surgery, Paloma died from cerebral edema and severe lung damage. Carlos arrived at the funeral, expecting to grieve a child lost to COVID. During the service, family members mentioned that Paloma's breasts appeared larger than normal. Carlos asked his ex-wife's relatives to leave and privately examined his daughter's body. He discovered fresh surgical scars across her chest, abdomen, and buttocks. The truth emerged in the most devastating way possible. The Durango prosecutor's office launched a criminal investigation for negligent homicide, and Victor Manuel Rosales Galindo was provisionally suspended from practice. Kanye West's mother. On November 9, 2007, Donda West underwent multiple cosmetic procedures at a Beverly Hills surgical facility. The 58-year-old English professor and mother of Kanye West had requested a tummy tuck, breast reduction, and liposuction. Approximately 5 months earlier, Dr. Andre Abulian had refused to operate on her without cardiac clearance due to heart concerns. Donda found a different surgeon willing to proceed. Dr. Jan Adams performed the procedures that morning. Against his advice, Donda left the facility that same evening to recover at home with her nephew Stephen Scoggins, a nurse, and friends. The following day, her condition deteriorated rapidly. She experienced chest pain, shortness of breath, excessive sweating, persistent cough, and fatigue. That evening, Donda stopped breathing. Her caretakers called Dr. Adams before calling emergency services. Paramedics eventually arrived and attempted resuscitation. They transported her to Centinela Freeman Regional Medical Center in Marina del Rey, where she was pronounced dead. The Los Angeles County Coroner's final report, released January 10, 2008, determined coronary artery disease as the cause of death, with multiple post-operative factors contributing. California later passed the Donda West law, requiring medical clearance before cosmetic surgery. Unlicensed recovery house. On March 5, 2025, Amonique Miller and her 19-year-old sister Kiera Barnes traveled from Las Vegas to Miami for planned cosmetic procedures. The following day, both sisters underwent surgery at Ivana Plastic Surgery on West Flagler Street. Amonique, a 28-year-old mother of a 1-year-old daughter, had a Brazilian butt lift and liposuction. Both were discharged to Keela's recovery house for post-operative care. They paid $1,500 for a 6-night stay at the unlicensed facility. On March 7th, between noon and 1 p.m., Amonique was put to bed for rest. Recovery house owner Keela Oliver, who had no medical license, administered unprescribed medications. She gave Amonique an unknown number of muscle relaxers from Kiera's prescription and 2 Percocet pills from an unlabeled bottle. For the next 8.5 hours, Amonique remained in bed, with no medical monitoring or vital signs checked. At 9:30 p.m., Kiera became concerned when her sister still hadn't woken. Staff found Amonique unresponsive. When police and paramedics arrived at what responders described as an illegal post-plastic surgery recovery home, they found Amonique lying face down, heavily bandaged, with her body exhibiting signs of rigor mortis. She had died hours earlier. At 10:26 p.m., Amonique Miller was pronounced dead. The Miami-Dade medical examiner ruled the death as acute combined drug toxicity from unprescribed oxycodone and bromazolone, a designer drug. Missing organs scandal. On March 26, 2024, at 9:30 a.m., Kaydel Brown entered the operating theater at Clinic Expert in Istanbul, Turkey. The 38-year-old hairdresser and mother of 2 from Sheffield, UK, had purchased a mummy MOT package for £5,400. The package included a Brazilian butt lift, tummy tuck, and breast augmentation. Her sister Leanne waited in the recovery area, while clinic staff repeatedly assured her the procedures were progressing normally. By midday, Kaydel failed to return to the recovery room. Leanne asked staff where her sister was. That afternoon, 3 clinic staff members approached Leanne and informed her there had been complications. Cadell had died during surgery from a fat embolism. Leanne was denied access to her sister's body and essentially sent back to the UK while still in shock. 3 days after the death, Cadell's body arrived in the UK for inquest and examination by a UK pathologist. The examination revealed large portions of organs were missing. Parts of her brain, portions of her lungs, and sections of her heart had been removed. Sheffield coroner Marilyn Whittle opened an inquest into Cadell's death and indicated the death was likely due to fat emboli blocking a lung blood vessel. The missing organ portions complicated definitive cause determination, and surgeon Dr. Sinem Singin continues performing the same procedures at other Turkish clinics. Death risk concealed. In November 2019, Melissa Kerr traveled to Istanbul for a Brazilian butt lift at Medicana Katakoy Hospital. The 31-year-old from Gorleston, Norfolk, UK, underwent the procedure on November 19th. Approximately 3 hours into the surgery, during the fat re-injection phase, the injection cannula entered a vein. Injected fat entered the blood vessel directly. A fat clot formed and began traveling through her circulatory system toward her lungs. The clot reached the pulmonary artery, the main vessel supplying blood to the lungs, and blocked it. Acute respiratory failure occurred as blood could no longer reach her lungs for oxygenation. Melissa died on the operating table from acute pulmonary embolism. Norfolk's senior coroner Jacqueline Lake conducted an inquest in 2023. The coroner issued findings that Melissa Kerr was only given limited information regarding the risks and mortality rate from the BBL operation. The Brazilian butt lift has a mortality rate approximately 10 times higher than other cosmetic procedures. The coroner ruled inadequate informed consent, and Melissa's death prompted a UK-Turkey government diplomatic meeting to discuss cosmetic surgery tourism safety standards. The UK implemented a moratorium on BBL procedures due to the disproportionately high death rate. By the way, if you find this informative, I cover stories like these regularly. Consider subscribing if you'd like to see more. Now back to the video. Partners' warnings ignored. In the months before August 2018, Leah Cambridge experienced body image issues after having 3 children. The 29-year-old beautician from Leeds, UK, became paranoid about excess stomach weight. Her partner, 31-year-old Scott Franks, repeatedly told her she was beautiful the way she was and didn't need surgery. Despite his pleas, Leah decided to proceed with a Brazilian butt lift in Turkey. On August 26, 2018, Leah and her mother traveled to Izmir and were transported to Izmir Private Can Hospital. The following morning, Leah was admitted and surgery commenced. The procedure cost £3,000, roughly half what UK surgeons charged. Approximately 1:30 p.m., during the surgery, complications arose when the fat injection cannula penetrated a vein. Fat entered her bloodstream. The fat clot migrated to her lungs and blocked the pulmonary artery. Leah's mother received notification that there had been complications during the surgery. Leah Cambridge was pronounced dead during the operation from a massive pulmonary embolism. Wakefield coroner Kevin McLaughlin issued an unprecedented ruling formally requesting the UK government consider banning BBL procedures nationwide. He stated their foremost duty was to protect citizens from what maybe was considered to be their own folly. Rejected, then approved. On April 18, 2022, Tanisha Walker presented to Bright Plastic Surgery in Weston, Florida. The 46-year-old grandmother of 11 from Indiana wanted a Brazilian butt lift and liposuction. Dr. Paul Goldberg evaluated her medical profile. With a BMI of 38.1, high blood pressure, and pre-diabetic status, he refused to perform the surgery. He stated her health required a hospital setting, not an office. 24 hours later, on April 19th, Tanisha presented to New Life Plastic Surgery in Miami. Dr. Oliver Simmons evaluated the identical health profile, now showing a BMI of 39.5, and approved surgery immediately. The following morning at 9:35, surgery began. At 11:05 a.m., Tanisha was moved to the recovery room. At 1:39 p.m., only 4 hours after surgery, she was discharged from the facility while feeling lightheaded. Instead of observing her due to the lightheadedness, staff arranged transport to a hospital. That same day, Tanisha died. The autopsy revealed a perforated abdominal wall, a damaged left kidney causing internal bleeding, and fat injected into the gluteal muscle, causing a fatal pulmonary fat embolism. Dr. Simmons received a $10,000 fine and investigation costs for approving a high-risk patient rejected by another surgeon 1 day prior. 7th, surgery fatigue. On June 16, 2021, at 6:32 a.m., Dr. John Sampson began his first surgery of the day at Seduction Cosmetic Center in Miami, Florida. Throughout the day, he performed multiple surgeries consecutively. At 8:31 p.m., 14 hours after starting, Dr. Sampson began his 7th-patient surgery. Erica Russell, a 33-year-old mother of 5 from Nashville, Tennessee, was undergoing a Brazilian butt lift. During the procedure, the liposuction cannula repeatedly penetrated the abdominal wall, perforating her liver, bladder, and intestines. The fat injection cannula was inserted too deeply into the gluteal muscle instead of tissue only, allowing fat to enter the bloodstream. Multiple organ injuries caused massive internal bleeding into the abdominal cavity. Fat entered the vascular system and traveled to her lungs, blocking the pulmonary artery. Cardiopulmonary arrest followed as her heart and lungs failed. At 10:50 p.m., approximately 2 hours after her surgery began, Erica Russell died. Investigation revealed Dr. Sampson was not authorized to perform surgery at the facility, and the clinic had misrepresented his hospital privileges. He was permanently restricted from performing BBL procedures in September 2022, and the family filed a wrongful death lawsuit in March 2024. Turned blue instantly. Before May 2019, Danae Placencia's grandfather, a physician, explicitly warned against cosmetic surgery. He told her he didn't want to even hear about it. Danae also knew that her cousin had undergone the same procedure at MIA Aesthetics in Miami and was hospitalized for approximately 2 months with complications. On Friday, May 10, 2019, the 28-year-old mother of 3 children, ages 1, 5, and 9, proceeded with a Brazilian butt lift at the same clinic anyway. The surgery concluded, and the initial assessment appeared successful. Then, as Danae was being moved from the operating table to a stretcher, she suddenly turned blue. Clinic staff witnessed the acute deterioration and dramatic skin color change, indicating severe oxygen deprivation and respiratory or cardiac failure. Danae was immediately rushed to Baptist Hospital in Miami for emergency intervention. At Baptist Hospital, Danae went into cardiac arrest. Despite resuscitation attempts, she died from a fat embolism. Fat had entered her bloodstream, traveled to her lungs, and blocked the pulmonary artery. The Miami Police Department's Homicide Bureau opened an investigation, unusual jurisdiction suggesting suspected criminal negligence. MIA Aesthetics stated this was their first and only patient fatality in years of operations, despite her cousin's prior 2-month hospitalization at the same facility. If you found value in this, a subscription helps me continue researching these stories. Thanks for watching.